Okay, all right, so we're on. I don't think Dr. Lindquist is on yet, but I'm excited to talk with him. I became acquainted with him just actually over the phone almost a year ago. In July, I was caring for a patient and I needed really urgent assistance from someone who knew more than I did about infectious disease, and so I tried to call my health department. I called all these people. Of course, it always, if you work in the medical field, you know, like it always happens on a Saturday. And it always happens right before you have plans to go somewhere and do something that you've committed to. So anyhow, Dr. Lindquist ended up being the one to call me, and I didn't know he was a state epidemiologist because I'm really I'm pretty green in my career, to be honest. And so like I was really excited that he was able to help me because it really did help me be able to care for the patient properly. You know, give them the best care that they deserve, that everybody deserves. So anyhow, I've got a few notes here as far as topics I want to talk to him about. I want to talk to him like about why are epidemiologists worried about sorry, I'm moving around a lot. Why are epidemiologists worried a lot about coronavirus and SARS-CoV-2 or COVID-19, whatever you want to call it, if it's such a small percentage of people, of the population, like all over the world, like we can look at that, but then like I've heard a lot of clinicians saying, well, it's such a small percentage, like we don't need to worry. To me, that still worries me. I mean, and again, I'm just a worrier, but I think that it's important to know like where the science is and why they're telling us that, because I think it's a great sorry, I'm multitasking. A great question for someone who's an expert. So other thing I want to talk to him about is the testing. What if you want a test and you can't get one? You know, I know there's got to be a lot of people out there who've wanted a test and haven't been able to find one, myself included, and I'm a healthcare provider. And I had just gotten back into the country from South Korea, symptomatic, I have like some autoimmune conditions, which, you know, it's a rough road, but I'm doing okay. But like I called around to try to get a test and I couldn't get one. Like I didn't qualify because of my age and because I wasn't sick enough. And I understand that. Like as a healthcare provider and as someone who is all about, you know, using resources efficiently and effectively, you know, like kind of like utilitarian, you know, utilitarian principles. I totally agree with that, you know, rationale, but I just, I think it's hard for a lot of people, if you maybe haven't worked in healthcare, or if you know, let's say you work in some other aspect of healthcare, but not like directly dealing with infectious diseases a lot, like it's hard to conceptualize why we need to worry, you know, I think. And then other thing I don't know if we'll end up talking about this because he's a very busy guy and he doesn't have a lot of time. So I do want to talk to him also about the need for masks and like what should we be doing to basically help the effort? Like, should we be using manufacturing facilities? What should we be doing? So anyhow, I'm going to pause this video just because I'm going to pause the recording because I don't want to keep blabbering. And anyway, okay, I'm going to pause it and figure this out. Oh, so here he is. He's going to join in. I think he's getting connected to the audio. So we'll wait for that. Oh, hi there, Dr. Lindquist. Can you hear me?
Hey, yep. Sorry, I'm late.
Oh, that's okay. No worries. I think it's it's using my computer audio. Okay, sorry, I had my headphones in. How are you doing today?
I'm doing good. little busy, but
Thank you so much for agreeing to talk to us. Oh, hi there. Nice to see you in person. Since I just had talked to you almost a year ago about a patient care matter, and you really helped me out. So, anyways, what I want to talk to you about today, I mean, like, really, I want you to tell me what's the most important thing that you think, as an epidemiologist in the state of Washington, that people should know, in particular in this state.
Are you talking about COVID specific
Yes.
or just in general? Okay.
About COVID, yeah, COVID, because I think for me, this has brought, as a clinician, this has brought up questions about, like, you know, I've heard other clinicians saying, okay, well, why are we worried if it's such a low percentage of the population that has it? And so I'm wondering what your perspective is on, like, why that actually is important, you know, and if you could explain that in a way like that, maybe we can communicate a little better with people.
Yeah, well, I think this pandemic is unprecedented in anything we've seen during our life period. The attack rate, which is defined by R naught, is very high, and the number of deaths are more than we've seen with flu for sure. So this is a pretty serious killer and pretty infectious. And I mean, more people have died of this COVID in just a few months that we've had it that died during the entire Vietnam War.
Wow, that is really sobering. I mean,
yeah.
Wow.
So I think it's important. I mean, it may not touch everybody's life, so it's easy to be an armchair epidemiologist, you know, and have your opinion about it. But I think for us in Washington State, the numbers are pretty staggering.
Yeah, and I think, I mean, it's my understanding, I guess, that in Washington, we're actually doing a pretty good job. Is that a fair assessment, or what do you think?
Yeah, I mean, we were the first state to have it, but we were able to flatten that curve for the most part in the Puget Sound area because of the social distancing.
Yeah.
But, I mean, look what this has done to the economy. It's absolutely killed the economy.
Yep.
So there's no way to ignore the impact of this pandemic. But even in Washington, where we've been able to, quote, flatten the curve or, you know, limit the spread with our social distancing, it still had a huge impact and quite a few people have died.
Right. Yeah, I mean, I think I had COVID. I don't know, though, because I couldn't get a test, but just the fear that I think that it's palpable. It's a palpable fear almost that I sense from other people, from the general public, and they're getting all this information from the news and all of this, but it doesn't it's too much information to process. So what would you say to somebody that wants a test and can't get one because of, like, the restrictive criteria because of our supply chain issues?
Yeah, so there's no longer any restrictive criteria. Anyone who wants to can get it. The sample supply has improved continuously over the last, you know, couple months. So there's definitely plenty of supplies. I mean, one of the things for people that have tested or thought that they had COVID before but didn't get tested, you can get your antibodies checked to see if you actually mounted a response against that. And that can be ordered through the University of Washington.
Oh, okay. Good to know.
So that's available. Again, you have to go somewhere that can draw your blood and order the test. But for anyone that's symptomatic with fever, cough, sore throat, any of the symptoms that match, yeah, they should be getting a PCR test. That appears to be the best test.
And does it matter between which labs? I mean, obviously, like, I have total respect and trust in UW or University of Washington. And with regards to the antibody test, you're talking about, like, the IgG, IgM?
Yeah.
Okay.
So the UW is doing an IgG test. There's a lot of serology tests on the market. They are not being FDA approved, so you got to be really careful.
Yeah.
Only with a reputable lab that shows good sensitivity and specificity, and that UW lab is one of those such labs that really doesn't have a lot of cross reaction with other viruses, so that antibody test tends to be fairly accurate.
Okay, that's good to know. So would someone have to is it just that you have to send the sample up there, or do they have to actually go up to Seattle and go to UW to get it drawn, or they can go anywhere?
Yeah, no, the lab's not drawing samples. You actually have to get your blood drawn.
Oh.
And the test ordered, your insurance information put in, and then that gets sent to the University of Washington lab. Yeah.
That actually sounds way more accessible than like what I'd been hearing from, I don't know, like local health departments and stuff. So I'm really glad to hear that.
Just go online to the UW Virology Lab, go to COVID-19, and then it has the lab slips that you can download and print, and the directions on what specimens are needed for either the PCR or the serology test. They're not free, so you gotta have insurance or pay.
How much do someone have to? And that's the thing. I think that with the economy being absolutely just, tanked, I will say. I think I'm not an economist, but how are people supposed to? How is that accessible for everyone? Like I hear constantly, everyone can get a test. Like that's the messaging, but then not everybody has the money for a test. So like where do we?
So how
do we do it?
The State Public Health Lab is free. There's no cost to send through the State Public Health Lab. But again, you still have to get to a provider or a facility that's doing testing to get it sent to the Public Health Lab. The majority of the tests that we're doing here at the Public Health Lab are outbreaks. So big outbreaks in farms or meat packing plants or things like that. So that's the majority of the testing that's being done. But for someone who doesn't have insurance, it's free at the Public Health Lab. You just have to go through your county health department.
Okay, so they should call their county health department and contact them to get a test if they want one.
I would call their provider first.
Provider, okay. And their provider should call the health department.
Mm-hmm.
Okay, so go up the chain of command until you get your answer, kind of.
Yeah, well, the provider is the one that's going to draw the specimen, so that's why you got to talk to your provider, because they're the one that's actually going to swab your nose.
Okay.
Health departments aren't going to be in the business of swabbing people.
No, they got more work to do.
Yeah, they got other things to do. Yeah. Right.
Yeah.
Right.
It's the on the ground folks that have to learn how to do the test, and really it's pretty simple. It's a nasopharyngeal swab, so it's miserable, but it's quick, and PCR testing is quick too, right? The polymerase chain reaction. Okay.
Within a day.
Okay, yeah, one day.
And there's the method that most of us are using right now is a nasal swab instead of a nasal pharyngeal swab.
Great.
So it doesn't hurt. And it's also the patient collects the sample. So you take the swab 4 times around in one nares, 4 times around in the other nares with the same swab into the viral transport media, and there you're done. It's really easy.
That sounds so easy. So I'm glad to hear that. And okay, what was my other question? So yeah, as a public health expert, what if someone like maybe there's a barrier for them, like maybe they don't have health insurance, like you were saying, or they can't afford their copays. Should they just, if they're symptomatic and not like knocking on death's door, should they just assume they have it and act accordingly? Or what would your advice be on that?
Yeah, I think that's one strategy. It's fine, but if you're symptomatic, then you'd have to be isolated for 10 days.
Right.
So I would much rather encourage people to get tested to know their status, just so we're understanding this a little bit better, especially with the widespread availability of the testing now. I would push to get tested.
Awesome. Yeah. Okay. That's really good for me to know as a clinician, in case I see anything that I'm concerned about. And then what else did I want to talk to you about real quick? Let's see. Oh, I saw you talking about, I don't know what news outlet, but you were talking about how like the supply chain stuff as far as the N95s, and have we seen that get better here in Washington?
Yeah, that's been getting better also.
Cool.
Yeah, so just slowly, a lot of this is getting bigger. We have a warehouse in Tumwater that's got a lot more samples and supplies in it now.
That's good.
Probably than when I did that interview.
Yeah, that's great, because I think that just goes to show kind of like, hey, like science changes over time, and our understanding of COVID it's gonna kind of percolate and develop. So I think that's really illustrates that. Yeah. Okay. Well, anything else you have to add as far as things you think people specifically in Washington, but also all across the country should know about this as a, since you're an epidemiologist?
Well, I think as we start relaxing these social distancing and people are getting closer than 6 feet to each other, people definitely should be wearing face coverings. You don't need to wear an N95 mask, but you need to have something to prevent you from exposing other people, especially if you have the virus and you don't know it. So I think as we relax the social distancing, masks in public places should be mandatory.
Okay. And not mandatory because we're trying to control people, mandatory because we care, right?
Yeah,
we don't want this to spread.
And by mandatory, I mean mandatory to interrupt the transmission.
Yes, I understand. I understand what you're saying. I think that, sometimes the language just gets a little misinterpreted for some people. So, okay. So what about people who are sometimes I've seen people who are wearing the cloth masks, they're touching their face more almost. And I've noticed that with myself too, if I'm wearing a mask. So what's the guidance on that and how they, I
mean, the fact of the matter is we all touch our faces multiple times, and it's really hard to say, hey, stop touching your face. That mask prevents you from spraying particles out on other people. It's not really protecting you. So whether you're touching outside or not, as long as you have it in place when you sneeze or cough or talk, that it's doing its job. They're not perfect. They're not PPE in the sense of preventing me from getting an infection. The point is, if I'm out in public close to people, I don't know whether I have COVID or not, because there's a lot of asymptomatic people, or even if I do have symptoms, at least it's a barrier for me spraying particles on other people.
Right. Yeah, that's been my understanding, and I think that's a great rationale for why we all should wear face coverings in public. If we're going to be around people, if you're alone in the woods or you're alone fishing in a lake, I don't care if you wear a face covering. That's up to you. But I think that's a great point. And as far as that goes, my other question would be airborne versus droplet. What's the latest and greatest on that?
Yeah, so I think most of us are pretty much in the camp of it's droplet spread.
Okay.
There have been some studies done. They're not really conclusive that it's airborne, and most of us are going with the concept of droplet precautions, and that seems to be working well, and that's what the WHO is supporting.
Okay, I'm glad to hear that, because I was initially really worried, about airborne and okay, do I need to wear an N95 with every patient, or should I wear a surgical mask? Or there was confusion, and I think that's confusion in our society, in this information society where everything goes viral faster than COVID. That basically it's hard for us to kind of process all that at once. So I think it's really good for the public to kind of understand that scientists are always, we're going to change, we're going to shift and change, and the information is going to get better. So I think that's an important point.
So in clinic, I'm wearing a surgical mask. I'm not wearing an N95 mask.
Okay. So that makes sense to me. And surgical versus cloth, I mean, I wear a cloth face mask when I go out in public, but I wouldn't do that in patient care. I would wear a surgical mask.
Correct. That's right.
Right. Okay. And then the surgical masks, with the limited supplies, I mean, usually I change it between each and every patient, but we have to be practical, because nobody's perfect and nothing in our world is perfect right now. So I'm just wondering, what's your recommendation as far as how to, should I still be changing it between each patient, or is it safe for me to wear as long as it's not soiled?
Yeah, I think depends on the supply of surgical masks you have. If you have enough masks, change it between every patient. That's the ideal. But if you don't, this is where you really got to come in with these concepts of, if you're wearing a surgical mask, which is protecting you, and you're breathing in potential COVID, do not touch the outside of that mask. If it becomes visibly soiled or wet, then you got to change it out. But if you have to conserve PPE, you can wear it between patients. You just can't touch it. And if it gets soiled, you got to take it off.
Yeah, that makes total sense and is really really good practical advice, I think, for the general public and clinicians to know. And I think that's, well, not, I mean, I could probably talk your ear off for hours, but I know you're a very busy man, so I'm going to let you go.
Okay.
And we'll chat again. I really appreciate your time, and thank you for meeting with me.
No worries. Thanks. Sorry for being late.
Oh, it's okay. And this is okay. I just want to confirm this is okay for me to post on our YouTube channel and potentially podcast, whatnot.
Yeah,
okay.
Cool.
Thank you so much, Dr. Lindquist.
Okay.
Bye.